We will discuss about a very important topic, that is rheumatoid arthritis. And the topics which we will cover in this video are: what is rheumatoid arthritis, what are the clinical symptoms, that is, what are the signs and symptoms of rheumatoid arthritis. Then we'll talk about what is the investigation, that what is the diagnosis for rheumatoid arthritis. So if you are suffering from rheumatoid arthritis, so what are the tests that you have to perform in order to diagnose whether in actuality you are suffering from rheumatoid arthritis or not. The next we'll talk about the management part, that is a basic part of this video, that is how you can manage rheumatoid arthritis in a natural way. And we will also discuss about a diet plan for the persons who are suffering from rheumatoid arthritis. So these are the basic topics that we will cover. So first of all, we'll talk about what is rheumatoid arthritis. So rheumatoid arthritis is an autoimmune disease that can cause joint pain and damage throughout your body. The joint damage that causes usually happens on both the sides of the body. So if a joint is affected in one of your arm or legs, the same joint in the other arm or leg will probably be affected too. This is one way that doctors distinguish from their form of arthritis, such as osteoarthritis. Now next we'll talk about the clinical symptoms, that what are the signs and symptoms of rheumatoid arthritis that you can observe in your body if you are suffering from rheumatoid arthritis. So rheumatoid arthritis is a chronic disease, as we all know that, and marked by symptoms of inflammation and pain in the joints. These symptoms and signs occur during periods known as flares or exacerbations, and other times are known as periods of remission. This is when symptoms disappear completely. While rheumatoid arthritis symptoms can affect several organs in the body, and the joint symptoms of rheumatoid arthritis include joint pain, joint swelling, and joint stiffness, loss of joint function, and deformities. So these are the basic signs and symptoms that you can observe in a patient who is suffering from rheumatoid arthritis. Now next, what are the diagnoses for rheumatoid arthritis? So, diagnosing rheumatoid arthritis can take time and may require multiple lab tests to confirm clinical examination findings. Your healthcare provider will use several tools to diagnose rheumatoid arthritis. Firstly, they will ask about your symptoms and medical history. They will also perform a physical examination of your joint. This will include looking for swelling and redness. Second, examining joint functions and range of motion. The next, touching the affected joint to check the warmth and the tenderness. The next, testing your reflexes and muscle strength. And if they suspect rheumatoid arthritis, they will most likely refer you to a specialist called rheumatologist. Since no single test can confirm a diagnosis of rheumatoid arthritis, so your healthcare provider or rheumatologist may use several different types of tests, like they may test your blood for certain substances like antibodies, or check the level of certain substances like acute phase reactants that are elevated during inflammatory conditions. And these can be a sign of rheumatoid arthritis and help support the diagnosis. And they may also require certain imaging tests such as ultrasound, X-ray, and MRI. That is blood test for rheumatoid arthritis. So we'll talk about this. So first one is rheumatoid factor test. This is basically a RF blood test to check for the proteins called rheumatoid factors. And high level of rheumatoid factors are associated with autoimmune diseases, especially rheumatoid arthritis. And second blood test is cellulated protein antibody test, that is anti-CCP. This test look for an antibody that is associated with rheumatoid arthritis. So people who have this antibody usually have the disease, and This anti-CCP-AB is more specific for rheumatoid arthritis than for the RF test. And another one test that is blood test is anti-nuclear antibody test. The anti-nuclear antibody panel tests your immune system to see if it's producing antibodies or not. Your body may make antibodies as a response to many different types of conditions, including rheumatoid arthritis. And another test is ESR, that is erythrocyte sedimentation rate. So the ESR test helps determine the degree of inflammation in your body. The result tells your doctor whether inflammation is present. If ESR is increased, then it indicates there is some kind of inflammation in your body. And it doesn't indicate the cause of the inflammation. And the last test, that is C-reactive protein test. A severe infection or significant inflammation anywhere in your body can trigger your liver to make C-reactive proteins. So high level of this inflammatory markers are associated with rheumatoid arthritis. So these are the various tests that you can perform if you have any doubt that you are suffering from rheumatoid arthritis or not. Now next, very important part, that is management. So how will you manage if you are suffering from rheumatoid arthritis? So let's talk about the natural management. So first of all, we'll talk about the homemade remedies for rheumatoid arthritis. That is, first one is exercise. So low impact exercises can help to improve the range of motion in your joints and increase your mobility. Exercise can also strengthen muscles, which can help to relieve some of the pressure from your joint. And you may also want to try gentle yogas, which can help you regain strength and flexibility. Next, get enough rest. You may need more rest during flare-ups and less during remission. Getting enough sleep will help to reduce inflammation and pain as well as fatigue. Next, apply heat or cold. Ice packs or cold compressions can help to reduce inflammation and pain. They may also be effective against muscle spasms. You can alternate cold with hot treatments such as warm showers and hot compressions. This may help to reduce stiffness. Next, try assistive devices. So, certain devices such as splints and braces can hold your joint in a resting position. This may help to reduce inflammation. And canes and crutches can also help you to maintain mobility even during flares. You can also install household devices such as grab bars and handrails in the bathrooms. Now let's talk about the diet. What diet you should take if you are suffering from rheumatoid arthritis. So let's talk about the diet chart here. So your healthcare provider or dietitian may recommend an anti-inflammatory diet to help with your symptoms. This type of diet includes foods that have lots of omega-3 fatty acids. And foods which are high in omega-3 fatty acids include fatty fish like salmon, tuna, herring, and mackerel. Next, chia seeds and flax seeds, walnuts. So these are some foods which are high in omega-3 fatty acids, and they are good for rheumatoid patients who are suffering from rheumatoid arthritis. And antioxidants such as vitamin A, vitamin C, and vitamin E, and selenium. They may also help reduce inflammation. And food high in antioxidants include berries such as blueberries, cranberry, goji berries, and strawberries. Dark chocolate, spinach, kidney beans, and pecans, artichokes. And eating a lot of fiber is very important for rheumatoid arthritis patients. According to some researches, fiber may help reduce inflammatory responses, which may decrease C-reactin protein level, which is generated by the liver. So choose whole grain foods, fresh vegetables, and fresh fruits. Strawberries may be particularly beneficial for this. Now, food containing flavonoids can also help to counter inflammation in your body, and they include soya products such as tofu and miso, berries, green tea, broccoli, grapes. These are some foods which are high in flavonoids, and they help in reducing inflammation. Trigger foods, and choosing the right food is trying to follow an anti-inflammatory diet may help you manage your rheumatoid arthritis. So this was all about the management. If you are suffering from rheumatoid arthritis, so what are the foods that you have to take, and what are the foods that you have to avoid, and what are the diet that you have to maintain? So that's all in this video. We have discussed about rheumatoid arthritis. What are the clinical features, that is the signs and symptoms. The next, we have discussed about the diagnosis, that is the diagnosis investigations, that how you can know what are the various tests that you can perform if you are suffering from rheumatoid arthritis. And lastly, we have discussed about the management part. So that's all. That's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. Stay safe, stay healthy, and stay tension free. Don't forget to meditate and practice pranayams, yogas, and aerobic exercises daily at least for 3 hours. And yes, thanks for watching our video.